Hi guys, my name is Sydney. I'm a registered nurse here at New Age Aesthetics, and I have my beautiful patient Melissa here, and today we're going to be doing some lip filler. I'm excited to take you with me. So what is lip filler? Lip filler is a type of hyaluronic acid that we can inject inside lips. So what we're going to do is we're going to take a little tiny needle, inject it on the border of your lips, and we're going to just use it to make it more voluminous, make it look more moisturized, and overall aesthetically pleasing. All right, so let's get this started and follow along with me. So what we're going to do first is numb the patient. We've already gotten a chance to talk with Melissa about what it is that she wanted to get done, and now we're going to have a chance to actually freeze her to make her journey more comfortable. We're going to leave this on for about 20 minutes, and you might feel a little bit of tingling and stuff. That's completely normal. So this is where all the goods are. What we have here is the dermal fillers, and so that's like the hyaluronic acids that I was speaking about before with lip filler. So there's a certain way that we're able to tell which ones to use in which area of the face, and that's based on the G prime. The G prime is what we base our choice on for the type of filler that we're going to use. The higher the G prime, the stronger the mold is, and the lower the G prime, the softer it is the best way I could try to explain it. So you'll have to be able to know a brand's products in order to be able to choose the right one, because they have all these sorts of different names. So for Restylane Kiss, that's what we're going to be using in the lips, and that means it has the softest G prime in this line. And then we have other ones such as Restylane Lift, and this is going to be one of the higher G primes, and that's going to go in areas like the cheeks, the chin. You can put it in the back of the jaw or along the jaw. We also could do other ones like Volime, and that's really good to put in the lateral cheeks because it gives like a nice projection. It's a very full product, and the G prime is quite high on it as well. So let's move on to step 2. Step 2 is going to involve myself taking out the medication that's in here, and I'm going to put it in a bunch of these tiny needles, and that's just to help keep the needle fresh and the pain very minimal. Step 3, let's transfer the medication. So we're on to step 4. I have all my medication all set up right here, and we're gonna get started. I've already cleansed the bottom ones and gave her a quick cleaning before we started. I like to keep on at the bottom just to help make sure that it's really frozen by the time that we get there. We're gonna be staying in like the pink border. So I wanna make sure I'm injecting inside of the lip, because the outside, there is a little tube that runs along your lips, and if I get inside of there, then it gets projected, and we don't like to do that. Ideally, what I'm looking for is I'm staying in a certain level of the skin, and I want to make sure when I'm injecting that I'm injecting evenly and that there's no pain that she's having. I want to also go with what makes her lips look best, like for herself, her natural beauty. I want to go with the natural shape of them. It's totally normal to bleed a little bit. Obviously, I'm creating a bit of a puncture. As you can tell, we're not uncomfortable. We're settled. Everything's frozen, and going to be injecting in an area that is very sensitive, so bleeding is quite normal. However, if you take Advil, if you take alcohol or anything like that about 24 to 48 hours ahead of time, then it's going to be a bloodbath. So please do not do that, because it's going to be so hard to inject, because we're going to be trying to rush against the swell, against the amount of blood that's coming out of there. And that's just because alcohol and Advil, it all makes your blood thin, and it's not a bad thing by any means, but it looks like a horror movie.
You find most people are pretty comfortable with all this stuff?
Yeah, most people actually want to watch it, which is funny. They find it so interesting, so they'll be watching a lot of it online before they come in. But a lot of people are okay, and it's always so nice to see after we're done how big of a difference it makes in the confidence. I don't want to be cheesy, but how amazing is it to be able to be a nurse and hurt people but have them be happy afterwards.
Hey guys, I just got my lip filler done at New Age Aesthetics with Sydney, and right now my lips are swollen, but I am looking forward to the final results. Sydney walked me through the whole process to make sure that I was at ease, and overall it was a very comfortable experience.
Okay, we're done. Take a look.
Oh my god.
you.
Yeah, you're so welcome. Oh, I'm so happy.